Get ready, everybody. St. Mark's Hospital will undergo a big renovation and expansion. We have Mark Robinson here, the CEO of the hospital, joining us with all the good information. Welcome.
Good to be here.
Okay, so we're talking renovation, expansion, everything.
All the above.
Walk us through it.
Anything you could think of. And I got to tell you, I'm so proud of my team at St. Mark's. Our mission statement is, above all else, we're committed to the care and improvement of human life. And we know that part of that care and improvement of human life has to do with the physical plant by which we work in every day and by which our patients are in when they're an inpatient or just visit the hospital. So what we are doing is we are going to erect a 5-story brand new tower right in front of the existing building. And what this is going to do for us is it's really going to give us that environment that we can, that is conducive to patients being a part of the care plan even more than they are now, bringing families together, bringing clinicians together. Our rooms now, as they exist, are 150 square feet. Very, very small.
Yeah, not very big.
Per code, and when we get the tower finished, each room will be roughly 300 square feet, so double the size. And again, we're bringing in the elements of Utah, which is just a really cool piece of this project. So what you'll see is, you'll see elements of the mines, you'll see elements of the Salt Lake, you'll see elements of those great views that we experience every single day, the beautiful nighttime stars that we see every single night. And that will be throughout the hospital, with good curvature of geometry that the architects and the designers are putting in the plans. And again, just always going back to our mission, to making sure we're doing things that create that environment that people can just get out of the hospital. We don't want to keep them, and they don't want to be there.
No, you're totally right. So while this is all happening, service will not stop, and you've got a lot going on on that piece of property.
That's the tough part. So we are a 308-bed, full-fledged level 2 trauma center that will continue to have the ambulances come in, continue to have the helicopters land on top of the building, bringing the sickest of the sick people to get care at St. Mark's Hospital. And we will be shutting down our front entrance, but we will be very clear and very specific as to how we reroute everybody that chooses our hospital for care. And so whether it's parking or how to get into the hospital, the wayfinding will be very easy, and there will be not only signage but also people through the duration of this project helping folks.
Let's talk about the community impacts,
Sure,
because obviously we talk about how that is the main
So
job of
important.
the hospital, but talking in the big picture, when this is all done, how will this make St. Mark's better for Utah?
It's awesome. So number one, again, I can't reiterate enough the healing environment that this provides. It is such a necessary project for us. The city of Mill Creek, the citizens of Mill Creek have been absolutely fantastic in helping us plan this and get through all the proper permitting and things like that, and zoning. And we're a tax-paying organization. We are an investor-owned hospital. We pay taxes. There are $29 million in taxes that we pay roughly every year, whether it's federal, state income tax, all the above. That other facilities don't pay, but we have to, and that's how we give back to this community, so they can continue to improve schools, improve roads, and again, we appreciate that opportunity to be a community partner like that.
So this will start later this year?
It will start roughly breaking ground by probably the end of the year.
Okay.
We're hoping October.
Great.
And will last about 2 years.
Okay, so not too far off.
No.
Fantastic.
We're excited.
It is very exciting. Thanks so much for joining
Thanks
us
for
today.
having
We
me.
really appreciate it. More information, of course, can be found online at abc4.com.